Okay, so the first thing I'm going to do is I'm going to gather all my materials. Hi, my name is Kayla. I'm going to be your nurse for today. Can I get your full name and date of birth, please?
Kiara Galares, January 14, 2004.
Okay, I'm going to wash my hands and close the curtain for privacy. Are you in any pain today from a scale of 0 to 10, with 0 being no pain and 10 being the most pain you've ever felt?
No, a 0.
Okay, so what we're going to do today is a head-to-toe assessment. I'm going to be assessing different sections of your body today, all right? Okay, so the first thing I'm going to note is I'm going to note the client's posture. She has good posture. I'm going to also note her nourishment. She seems to be well nourished and seems to have good hygiene, as there is no foul odors or smells. Next, I'm going to be assessing the client's orientation. Can you tell me your full name, please?
Kiara Galares.
All right, can you tell me what day it is?
Monday,
The year?
2019.
And who our current president is?
Trump.
All right, client is awake and oriented, times 4. Next, I'm going to be stating that as I assess each section of the body, I'm going to be checking the skin integrity for color, temperature, and moisture. And then, having already done so, I would tell the client that her vital signs are normal within range, as we took her blood pressure, temperature, oxygen level, respiratory rate, and discussed her pain level, which was 0. Then I'm going to be inspecting and palpating her head, noting any abnormal findings and palpating any abnormalities, and everything seems to be normal, so phallic. Then I'm going to be palpating her sinuses and feeling for any tenderness and asking the patient, are you in any pain while I palpate your sinuses?
No.
Okay. After that, next I'm going to be starting off assessing her cranial nerves. We're going to be starting off with cranial nerves 1 and 2, olfactory and optic. I'm going to have the patient close your eyes, and can you cover one of your nostrils for me, please? And can you tell me what smell this is?
Vanilla.
Okay, and then can you cover the other nostril for me, please? And then can you tell me what smell that is?
Chocolate.
Okay. You can open your eyes, and then can you cover one eye for me, please? And tell me how many fingers am I holding up?
4.
All right, and then with the other hand?
1.
Okay, cranial nerves 1 and 2 are intact. Next, we'll be assessing cranial nerves 3, 4, and 6, which are oculomotor, trochlear, and abducens. I'm going to have the patient look at my pen, follow my pen light with her eyes. Okay, and then I'm going to have the patient look at my finger and disregard the light for me, please. Okay. Okay, pupils are equally round and reflective to light and accommodation. So cranial nerves 3, 4, and 6 would be intact. Next, we would be assessing cranial nerves 5, 7, 8, and 11, which are trigeminal, facial, acoustic, and spinal accessory. I'm going to have the patient close her eyes for me, please, and then tell me which side of your face you feel sensation on.
Left. Right. Forehead.
Okay, you can open your eyes. And then I'm going to have the patient clench her teeth, and then smile, frown, raise your eyebrows, and puff bubbles into your mouth. Okay, and now I'm going to have the patient shrug her shoulders against my resistance. Alrighty, and then push against my resistance. Okay, cranial nerves 5, 7, 8, and 11 are intact. And then the last cranial nerves that we will be assessing today are cranial nerves 9, 10, and 12, which are glossopharyngeal, vagus, and hypoglossal. So I'm going to have the patient swallow for me, please. Okay, and then can you say ah? All right, noting that the uvula is symmetrical. And then can you push against my resistance, please? All right, and then the right side, left side. Okay, cranial nerves 9, 10, 11, 9, 10, and 12, are intact. And then I'm going to inspect the patient's oral cavity, making sure that it is pink, moist, and no lesions are found. And everything seems to be okay. Next, I'm going to be inspecting and palpating the client's neck, stating that the trachea is midline, and then palpating her lymph nodes, making sure that there's no enlargements or tenderness. Are you in any pain as I touch?
No.
Okay. That's good. Next, I'm going to be palpating and auscultating the patient's carotid arteries. I'm going to be checking her pulse one at a time. Okay, and her pulse is equally bilateral, +2. And then I'm going to be taking my bell and listening to her carotid arteries one at a time. Okay. All right, and I would be listening to any bruit sounds, and none more present, which is good and normal. Next, I'm going to be assessing her upper extremities. I'm going to assess her skin integrity, checking for even skin tone, pink, and her arms are bilaterally warm and dry. Next, I'm going to be checking her radial pulses one at a time. Okay. And checking capillary refill. Her nail bed for capillary refill, which should be less than 3 seconds. Okay, now I'm going to be doing the patient's range of motion. For her upper extremities, I'm going to have the patient flex her elbows and then pull against my resistance. Okay, and then I'm going to have her bend her elbows down and then push against my resistance. Okay, I'm going to have the patient lift up her arms all the way up and then down and then abduct and adduct. And then can you grip my hands and then grip my fingers. Okay, the patient's range of motion and motor strength is equally bilateral, +4. And then I'm going to be inspecting her chest, making sure that it is symmetrical with no abnormalities, so her chest seems to be fine. After doing her chest, I will now auscultate her for heart sounds using my diaphragm. I'm going to start off by listening to her aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to make sure that I stay at the mitral for a full minute to check her apical pulse, which we already did. And then I would go back in with my stethoscope using my bell in the same 5 spots that I did before, and I would make sure that I heard the S1 and S2 sounds. I also forgot to mention that as I was inspecting her chest for symmetrical and making sure that her chest was symmetrical with no abnormalities, I would also be checking her skin turgor underneath her clavicle, making sure that there is no tenting, and there was none present, so that's good. After checking her chest and after checking her heart, I would be then moving on to her lungs, both anterior and posterior. I would be checking 12 in the front and then 12 in the back. And I would be doing so with my diaphragm. Okay, I would be going 1 and have the patient, while I check the front and the back sounds of her lung sounds, I would have the patient breathe in and out. 1, 2, 3, and 4, 5, 6, 7, 8, 9, 10, 11, and then 12, and then the back. I would be doing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, and then 16, making sure I avoided the scapula, and she had normal lung sounds. There was no sounds of any, there was no abnormal sounds. After doing her lungs, I would have the patient lie down for me, please. And now I will be inspecting her abdomen. I would be lifting up her shirt. Her abdomen seems to be flat with no parasitic waves or distension. Next, I will be auscultating her abdomen using my diaphragm. I would start in the right lower quadrant, right upper quadrant, left upper quadrant, and then left lower quadrant. I would be auscultating for a minute, 4 minutes up to 5 minutes per quadrant. After auscultating her abdomen, I would then move on to percussing her abdomen, going in the same sequence, going right lower, right upper, left lower, listening for tympanic and dullness sounds, which is normal. After percussing, I would then lightly palpate her abdomen in the same sequences as well, going in circular motions and asking the patient, do you feel any pain or discomfort while I touch your stomach, while I touch your abdomen?
No.
Alrighty, and that's good. After assessing the abdomen, I would then move on to the femoral pulse. The femoral pulse is located in the inner thigh, close to the pelvic area. Making sure that I do one at a time and having it equally bilateral +2. After checking her femoral pulse, I would then assess the genitalia, noting if there was any presence of any tubing or abnormal findings and any foul odors. I would then be assessing her skin integrity on her lower extremities, making sure that her color, that she is even in skin tone, that she is warm and dry, pink, bilaterally. I would then be checking her peripheral pulses, starting with her knee, the popliteal, behind her knee, popliteal, posterior tibial, one at a time, and then her dorsalis pedis, one at a time. Assessing that her pulses are equally bilateral +2. And then after doing so, after doing her peripheral pulses, I would then be doing her range of motion for her lower extremities. I'm going to have the patient flex her hip, and then down, and then flex her hip again. All right, and then can you flex your knee for me? Okay, again. And then can you flex your ankles, my bad. Alrighty, I'm gonna have the patient stand up for me, please. And then I'm gonna have the patient abduct and adduct, both legs. And then have the patient internally and externally rotate your, Okay, and then can you invert and exvert both feet? Okay, patient's range of motion and motor strength is equally bilateral +4. I'm gonna ask the patient to walk across the room and then back for me, please, so that I can assess her gait. And her gait seems to be normal with no trouble walking. Gonna have the patient close her eyes, and I'll stand behind her for at least 20 seconds and assess her balance, making sure she doesn't fall. And this is known as the Romberg test, and she has passed because she is able to stay standing with steadily and with no trouble. All right, and you can sit down. And so this would conclude our head to toe assessment. I would go ahead and document all my findings through assessing each section of the body, and I would also document that I communicated with the patient properly and adequately.